Okay, we're going to go ahead and get started with, I'll get started with the introduction. Thank you everyone for being here. This is one of our favorite days of the year where we get to highlight the importance of aging research, much of which is done here at Hopkins, but also at other institutions, especially at collaborators across the city from us at University of Maryland. So we're very, very excited to have Dr. Barbara Resnick here today as our keynote speaker. She is a professor in the Department of Organizational Systems and Adult Health at the University of Maryland School of Nursing. She holds the Sonia Ziporkin Gersowitz Chair in Gerontology. Did I say that right? Okay. At the School of Nursing and serves as a distinguished university professor of the University of Maryland, Baltimore. Dr. Resnick holds a BSN from the University of Connecticut, an MSN from the University of Pennsylvania, and a PhD in nursing from the University of Maryland. She's an internationally recognized expert in gerontology, and she focuses on developing innovative interventions to motivate older adults to engage in healthy behaviors, particularly with regard to function and physical activity, as well as other behaviors such as adhering to recommended immunizations and to managing pain and other symptoms commonly noted in aging, and to implement these in real-world settings. She's held leadership positions in multiple aging and interdisciplinary organizations, including American Geriatric Society, the Gerontological Society of America, and the American Medical Directors Association. She served as a board member in many of these organizations and has served on editorial boards and boards of organizations focuses on the care of older adults. She's received many, many awards for her work, so many I don't have time to read them all. But one of the most significant and more recent is the David H. Solomon Memorial Public Health Service Award from the American Geriatric Society. So please thank Dr. Resnick for being here and help me welcome her to give her talk on resilience and aging. Thank you.
So I loved that we do most of the aging work here in Baltimore, Maryland. Who knew? I'm just thinking across the country, they're freaking out. Let's hope no one heard that, right? But I'm thrilled to be here, and of course I do agree with that. Although who knows what others might say. But this happens to be one of my favorite things to talk about: resilience, to talk about, to live, and to try and engage clinicians to help people become resilient. Before I start, I want you all to take, though, a second and think about one of your most challenging life events, either physical, maybe it was you flunked a course and that was the most challenging psychological event you ever had, something that happened to you. Because as I talk, I want you to think about whether you were or maybe were not quite as resilient as you could have been, because it helps give it more meaning. I don't know if you can read that, but it says, life doesn't get easier or more forgiving. We get stronger and more resilient. And that's really, really relevant when it comes to older adults. And I'm not sure, Jennifer, do you know how to make it go forward?
Try the arrow keys. Does that work?
Which one?
You might have to try the arrow keys. Does that work?
I tried them.
Click into PowerPoint. Just click the mouse into PowerPoint.
Yeah, we're just gonna click here. And let's see if that works. And then you can use the arrows, I think, at this point.
That worked. That's, computer resilience. It's a new term. So resilience really has many, many definitions, all variations on the same theme. Resilience is generally, though, referred to as an individual's capacity to make a psychological or social comeback. Also could be a physical comeback, in the face of adversity. For there to be resilience, there's got to be a challenge first. Being resilient indicates the person has the human ability to adapt when they're challenged, when there's trauma, when there's adversity, and simply ongoing life stressors. I got to tell you guys, what do you think aging is every day? For some of us across the room, you don't know yet, but it'll come, and every day's a challenge. With regard to older adults, resilience is described as the ability to achieve, retain, or regain a level of physical or emotional health after an illness or a loss. Resilient people tend to show adaptive behaviors, and those are usually relevant to whether it's social functioning, their morale, their attitude, or their somatic health. The Resilience and Health Aging Network define resilience as a process of negotiating, managing, and adapting to significant sources of stress or trauma. Assets and resources within the individual, their life, the environment, their capacity for adaptation and bouncing back is a key feature of their resilience. And this is something that grows or maybe doesn't grow across the life's course. What defines us is how well we rise after falling. One of the most important things to think about resilience is that it's a dynamic process that's influenced by everything that occurs throughout our lives. You know, I don't know how many of you have ever taken care of an older adult who's never had a medical problem before. And all of a sudden, they're aging, and what's their biggest complaint? Their eyes drip or their nose drips. Like, seriously? That's the biggest concern. They haven't developed and may come and see you every day over that problem, but they haven't developed the resilience that somebody with a chronic illness has, because they've had to deal with it their whole life. So resilience really does and can change over time. It combines the person's personality, and some people are just born a little more optimistic, a little more resilient. It's the way they are, it's the way they approach life. But it can also be learned and developed. And as Tigger there says, life is not about how fast you run or how high you climb, but how well you bounce or bounce back. So what's the relevance of resilience? Well, older women who have successfully recovered from orthopedic or other stressful events describe themselves as resilient, or often they'll use the term determined, and they tend to have better function, mood, and quality of life. I'm sure you've all seen this in patients who have a hip fracture, right? Some, they're back there on the bike 3 days later. I've seen 100-year-olds do that. Others crawl into bed and they never get out again. Resilience has also been associated with adjustments following the diagnosis of dementia. Some people accept it and roll with it. Some people go into deep depression. It's been associated with widowhood and adjustment, management of chronic pain, and truthfully, the overall everyday stressors of aging. Not to be negative about aging, it's a wonderful thing, but it comes with certain changes. Older adults have sustained multiple losses over their lifetime, and they've accrued often positive experiences where they've been resilient. They develop resilience. And when we talk about measures in a couple of minutes, one of the hardest things is to measure resilience in older adults because it's so high. And how do you differentiate those that are so high and resilient but are the super resilient? We talk about the super agers, right? Well, they're probably the super resilient. Resilient responses are evidenced by demonstrating behaviors known to assure recovery. And there's certain people that measure resilience that way. You're resilient if you got better from that hip fracture. I'm not so much a believer in that because some people just easily recover. It's not even that much of a challenge for them because of their underlying status. But some people look at resilience based on recovery. I look at resilience as the person who works so hard, but maybe is still schlepping along and only able to walk a few steps. Resilience, specifically personality characteristics associated with resilience, like inherited traits, can facilitate or impede adaptive responses. And that's things like just, some people are more willing to go to a party when they don't know anyone, to be socially engaged, to pick up the phone and call somebody to go out to dinner. That's why I married my husband. He's really good at that, and I'll take him to any party. Me, rather not. So maintaining strong social connections is really one way to ensure you'll have support during a crisis. And we're seeing lots of research these days about the benefit. My God, social supports can help you live to be 100, right? There's a lot of work being done in that area. So what are resilient individuals like? Well, they tend to manifest adaptive behaviors, especially with regard to social functioning, morale, and somatic health. Resilient individuals are also less likely to succumb to illness or disability. And forgive me, it's a little bit of a sexist cartoon, but it really is, well, let's say, in some cases true. But how does a woman respond to a cold versus some men? The ultimate resilience, well, the ultimate definition of resilience is the ability to not only spring back to where you were, but to spring forward, or we think about growing. And think about your challenging experiences. Did you grow through it, or did you just get back to baseline? I like to look at resilience using the resilience model. And basically, when challenged by some type of experience or illness, the individual or any one of us has the choice to determine how we're going to respond, to use internal protective factors like self-resilience, self-efficacy, self-esteem, psychological and physical health, and other external protective factors like pulling on your social supports to grow through the experience. One of the hardest things I've had to learn with regard to resilience is to be able to ask for help. That's one of the components of resilience. But I'm stubborn and determined, and it's a really hard thing to do. So identifying some of those things and forcing yourself is one of the ways that we pull on protective factors. When we do that, and when we grow when faced with a challenge, it's referred to as resilient reintegration. Alternatively, you have a couple of choices. You can reintegrate and get back to your baseline function. You can maybe not so well respond and maybe get a little depressed, feel a sense of loss, never even get back to baseline. Or you may become really dysfunctional and start drinking and crawl into bed and never get out, become deconditioned, Or how many of you seen patients with contractures because they absolutely refuse to work with the physical therapist? Devastating to see, and it happens. And this is just a model. I know it's a little hard to see, but it shows you've got the stressor, disruption of hemostasis, and then the opportunity for reintegration. It might be resilient reintegration where you grow. Again, you return to baseline. You have some loss and some disappointment and just stay there, or you really fall apart and you have dysfunctional reintegration. The other thing about resilience that I think is important to remember is there's all kinds of resilience. There's health resilience, where it's the capacity to maintain good health in the face of a challenge. There's psychological resilience, if you're stressed for whatever reason. Emotional resilience, and the ability to maintain the separation between positive and negative emotions when you're stressed. To recognize, how many times do you stop and recognize, I'm really losing it here? And take a minute and pull it together and pull from your toes and begin that resilience. Dispositional resilience incorporates 3 personality characteristics, including commitment to others, a sense of control over outcomes, and a willingness to learn from the current situation. There's physiological resilience as well, where the body is able, I mean, even at the cellular level, and I know a lot of work is being done here at Hopkins with regard to physiological resilience. What's interesting to think about is there's also things we can do to optimize your physiological resilience, right? What's the best way to strengthen immunity? Physical activity, right? What's the best way to prevent metastatic cancer? Physical activity. Some fascinating research. So it's a little hard to wrap your head around because we don't always know when we're having those physiological challenges, but there's things that can be done. And there's physical resilience. And that's really the ability to recover or optimize function in the face of age-related losses or disease. And these are the many, many attributes of resilience. Positive interpersonal relationships, strong self-efficacy, positive self-esteem, a sense of purpose, spirituality at a sort of a bigger perspective, the ability to use humor. Can you stop and laugh at yourself? Creativity, acceptance of change. I think this is one of the most important areas of resilience, because if you can't take that first step to accepting, you know what? I had a hip fracture. You know what? I've got metastatic cancer. How am I going to respond? But you have to accept the change first. Maintaining a positive attitude or optimism is something you hear a lot about with regard to resilience. Some people even equate the two. The ability to identify and utilize resources, ask for help, look for those resources, self-determination, optimism, seeing joy in each day. I've been through multiple cancers and pretty yucky treatments. And I have a daughter who's an advanced practice nurse, and every day she says to me, what's going to be your joy in the day? And it's a great way to help yourself be resilient through those things, because sometimes you have to dig really deep for that joy. Grit is another thing, and a lot of these are words that people use to describe their resilience: maintaining hope, adaptive coping strategies, meaningfulness, prior experience with hardship, which helps you grow your resilience, self-acceptance, and self-care. And I don't know if you can read the cartoon. I just think it's a good example of a lady who's quite resilient. And then I blew out the candles and my dang old teeth popped out and landed on the cake. Ha ha ha. And all I can think of is she's sitting there thinking, good, more cake for me. No one else is going to eat it. This is another way to think about the attributes of resilience, the 5 C's, and it's control, commitment, connection, calmness, and care for self. I always like to raise what the difference is between motivation and resilience. And I actually started my research career focused on motivation and really still consider that a major component of outcomes. But resilience, unlike motivation, relies on an individual experience, a life challenge. The two go together, though, because you need motivation to be resilient, but they're not the same. So motivation is not dependent on an adverse event or challenge. Rather, it's a needed component for resilience. And interestingly, the many things that build resilience also build motivation, or vice versa. And one of the biggest things, I don't know how many of you in the room are familiar with Bandura's theory of self-efficacy, right? 4 sources of information, great ways to build motivation, but they also build resilience. Actually performing the behavior, verbal encouragement, role models, although sometimes older adults don't care so much about role models, I only care about me, right? And probably one of the most important is getting rid of unpleasant sensations to do a behavior. After a hip fracture, we have to treat the pain, we have to treat the fear, and engage the person in whatever they need to do to recover. Other differences between resilience and motivation: it's believed that all individuals have the innate ability to be resilient, but we make choices, and it's not easy. Sometimes the easiest thing is to crawl into bed and do nothing. So it's harder to be resilient. When faced with a challenge, the individual has to summon the motivation in the face of adversity to be resilient. And if not motivated to be resilient, the individual probably won't even get back to baseline. It's devastating. I do house calls now and see a lot of people who have had unfortunate falls during work experiences and spinal cord injuries. And these are older adults now who have been significantly disabled for a very long time, but contracted. When I see a patient with contractures, it's just heartbreaking because somebody was not helping them be resilient and engage in what needed to be done to prevent those contractures. And when motivated to engage in the behaviors necessary to be resilient, you're going to be more likely to end up with resilient reintegration and really grow from the experience. So how do we evaluate resilience? Well, older adults, by virtue of surviving through many decades, they tend to be really resilient. So it's really hard to evaluate in these individuals. Individuals have experienced multiple losses, including physical changes such as declines in vision, hearing, physical ability, social losses, losses of people, pets, and role-related losses. They may have been resilient from all of those experiences and have accrued the ability to be resilient over time. Also, when working with older adults, it's particularly helpful to explore their prior challenges, establish strengths with regard to recovery that suggest they're resilient. So one of the quick and down and dirty ways to evaluate resilience, before I go into the many measures that are out there, is to sit down in the bed and chat for a few minutes and ask somebody what their biggest challenge was. Or ask a family member what their biggest challenge, or at least a challenge, was, and how did they respond. And it'll give you a good sense of whether that person has some ability to be resilient, at least in that type of resilience. So understanding and evaluating resilience is important, mostly so that we can identify people who are low in resilience and do something about it, because it takes a lot of work. And we'll talk at the end about what are some of the things you can do to help people be more resilient. Determinations of level of resilience have been established through the use of multiple measures, and many different approaches have led to inconsistencies in the risk factors and some of the protective processes involved with resilience. And in the incidence of resilience across groups of older adults, and the meaning and the value of resilience. So some people look at outcomes, as I said, as the definition or as evidence of resilience. And some people look at resilience in general versus specific types. That's actually the most common way resilient. So it's just kind of a generic, you're resilient or you're not, versus all those different types of resilience I talked about: physical, physiological, psychological, emotional, financial. In today's world, yeah, we may all need very soon financial resilience, right? Think about particularly all of our colleagues in Maryland, right? So thinking about the different ways is quite important. I think you all know criteria to consider when you're looking at a measure, but it's particularly important with resilience. Is it a measure that's going to be good at picking up change? Or in use previously, are there significant floor and ceiling effects? I am not going to read these. I think you'll have access to the slides if you want all this information about the different measures, but just to give you some sense of what's out there. And these are only adult measures. There are a slew, and actually a lot more work in resilience in children. One of the most common ones, I would say, is the 25 and 14 item resilience scale by Wagnall and Young. And this is very much a general resilience measure. And I will show you some of the items on that measure. Hardy-Gill resilience measure has been around since 2004. There's a dispositional resilience scale, which is really designed to look more at psychological hardiness, more from the psychological perspective, although very, very similar to general resilience. The resilience appraisal scale also focuses on psychological resilience. The resilience scale for adults focuses on more intrapersonal and interpersonal protective factors associated with psychosocial challenges or adversity. The brief resilient coping scale is designed to measure outcomes following a stressful event. The resilience in midlife scale, supposedly developed for those in midlife. The Connor-Davidson resilience scale is also used quite commonly, focuses on coping with stress, and it was really initially developed for younger adults, but has been used a lot in older adults. The Baruth Protective Factors Inventory focuses more on traits and personality aspects of resilience. The brief resilience scale is commonly used as well and focuses on ability to respond to stress. The physical resilience scale, and I'll show you some of the items in that measure as well, really looked more at physical challenges and how people respond. Ego resilience looks more, again, at some of the psychological components. It was developed, though, for young adults, so some of the items not quite so relevant for older adults. And psychological resilience, again, focusing on more of the psychological, which is what most of the measures address. This is the physical resilience scale, and you can see the items look more at that ability to recover, to adjust to new changes, using humor, believing you could recover. So again, looking more at a physical challenge. What's important when we do analyses, again, as I said, to look at the reliability and the fit of the items to the concept. And I'm a big proponent of rash analysis. I won't go through the gory details of it, but it's a great way to get a better sense. What the rash analysis can do for you is show you what is the most challenging item for an individual versus the easiest item for the person to endorse. So it tells you if you've mapped out the entire concept or if you need harder items. And that's the biggest challenge with resilience measures is we can't differentiate the men from the boys. There are so many people that are so high in resilience, you can't differentiate them. And the rash analysis helps you pick that up. This is the 14-item resilience scale. And you can see the questions are a little more general here. I usually manage one way or another. I feel proud I have accomplished things in life. I usually take things in stride. I'm friends with myself. I feel that I can handle many things at a time. I'm determined. I can get through difficult times. I have self-discipline. I keep interested in things. I can usually find something to laugh about. My belief in myself gets me through hard times. In an emergency, I'm someone people can generally rely on. My life has meaning. And when I'm in a difficult situation, I can usually find my way out. So again, more that personality, ability to respond. This is the Hardy-Gill resiliency tool. And the nice part about this, I don't know if you can see the first item, but it requires the person to take a minute and think about the most stressful event you've experienced in the past 5 years. Do not consider events that have occurred in the past month. Not really sure why it says that, but that's the guidance. But it does try and get the person, and most of us do that when we're doing resilience testing, although generally you should be looking at resilience after a stressful event has occurred. So this one goes through how you score it, etc. So in review of the measures, and there are quite a few of them, all of them generally address assets of the person and available resources that facilitate resilience. Measures are most useful for measuring the process leading to resilient outcomes. Do resilient characteristics influence the outcomes? And some examples, again, are usually come through difficult times with little trouble. And as I said, one of the things I think is most important, I'm willing to ask for help. Accepting, asking for help, those are just some critical components. The caregiver can really promote resilience by being positive. I can learn all of this, listening well, giving warmth, talking and smiling. Not high-level interventions, guys. It's not hard, but it doesn't get done. Ideally, measures of resilience should address personality aspects of resilience, as well as availability and ability, willingness to use resources, asking for help, reaching out to friends and families for social support is critical for resilience. How many of you have seen those patients that, oh my God, they know how to milk it. They know how to get everything they need. And it drives you crazy, but all I can think to myself is, this is one resilient person. I see them in senior housing. Somebody's walking by, can you pick up for me? They will get it. They will get it. I would crawl to the drugstore before I asked. So personality aspects and belief. I was determined to recover. I adjusted to new changes. I used humor to help me through. I believed I could recover, and I focused on my remaining abilities, not on what I couldn't do. Another critical component. But those are just some of the items and some of the flavor of the many measures. There's limited evidence of reliability and validity across all measures. Some of these have not been used that much. So if you're picking a measure, you may want to look at that as well. Only one measure looked at change over time, and that's been the Connor-Davidson Resilience Scale. Although we also have looked at change over time in the physical activity measure. I should also say we used that measure to see if caregivers could evaluate resilience in people with cognitive impairment. And that can be done. Of course, they're looking back at the person's personality, but we have actually had some good luck with that. Most look at general resilience, as I said, not a specific aspect of resilience. None address cultural issues very well. Different cultures approach resilience differently. None cover the lifespan, and only the physical resilience measure addresses the ability to differentiate, as I said, those really high and really low. So consider what you're measuring resilience for, particularly the type of resilience that you want to look at. Again, if you're looking at physiological resilience, these measures may not help much. What are you using the measure for? Is it for change or just to identify those high or low in resilience so you can implement an intervention? Look at evidence of reliability, present in most of these, at least at a preliminary level, and the practicality of the measure. Some of them are longer than others. They actually range from about 4 items to 25. And as I said, there's an alternative measurement perspective. There's a big group that focuses on resilience based on what you see. Recovery from the hip fracture, recovery from a job loss, recovery from the loss of a spouse, a pet, a parent, adjustment or coping with changes associated with aging. Those that have healthy aging or live to be 100, does that make you resilient or lucky? or unlucky, depending on how you look at it. Adjustment to diagnoses and treatments of medical illness. Ability to measure the outcome of a stressor with regard to resilience. Again, looking at that recovery piece or evidence of resilience based on resilient reintegration. Successful recovery. These are some of the ways to think about interventions for resilience: living authentically, interacting cooperatively, maintaining perspective, finding your calling or your purpose, managing stress, and building networks. So the interventions to stimulate and build resilience really focus in 3 areas: developing the dispositional attributes of the individual, vigor, optimism, and physical robustness. How many of you know really pessimistic people that you like can't stand to be around because it's like you can feel that negativity? It's not easy to make them optimistic, is it? But that's our job in healthcare anyhow. So it's really thinking about how you can bring that out. Improving socialization practices. How many times have you seen that really depressed person that you just know if they would like leave the apartment or leave the room, maybe it would be better? I mean, granted, there are people who are very happy to stay in their rooms and relive their lives. I've learned that. But some people really need that social push and that social interaction. Then, as I said, strengthening self-efficacy, critical, self-esteem, which you can strengthen the same way you strengthen self-efficacy, and strengthening motivation, again, using those same techniques through interpersonal interactions as well as experiences. Just doing it. If you just go down one time to the social activity, you might like it, and you might be able to go back again. These 3 areas are really not mutually exclusive, and the interventions that strengthen physical robustness may improve socialization practices and strengthen self-efficacy. So if you go to the gym, you might have some interaction with other people, and you have both, the benefit of both going on. Multifaceted approaches to optimizing resilience are needed. It's not easy to do, and we got to attack it from multiple places. Risk-oriented strategies should be considered with all interventions to help assure that older adults are not exposed to experiences that might decrease resilience. A negative experience might be just trying and not getting any better. And it can dampen your resilience, and we have to work harder to help those people. Environmental interventions, such as chairs, beds, toilets, that facilitate successful transfers with aging. And these days, more and more really, really innovative devices are available, even with regard to tremor. I mean, what's a great thing today? If you have a tremor, you can't type on the computer anymore. What do? Voice, right? Drives me crazy. My husband's got a senile tremor. He talks to the phone all day long, and I have to listen to it. So I have to be resilient. Social networking systems help disseminate opportunities for successful activities and increase reach to older adults are likewise important and useful interventions when we're trying to strengthen their resilience. We got to be cheerleaders. That is the major component to building self-efficacy. Verbal encouragement, verbal encouragement, verbal encouragement. You can't ask once. If you ask once and the person says no, that's how contractures happen. right? You can never let it go. It's not always easy. Same with immunization work. Asking once is just not enough. Verbal encouragement, encouraging the person to go to a social event. Maybe you got to go with them the first time, but to get them there. Performance of the behavior, just let's try standing up. Just try that for starts. Role modeling and decreasing the unpleasant sensations. First, we have to find out what those unpleasant sensations for the person are. But when somebody's resisting you, it's often fear, right? Or pain. And sometimes those are hard problems to solve. I wish we've been doing research forever, right? And there's still no solution. But at least addressing it, acknowledging it. It's got to be really scary to get up and walk after you had a significant fall, right? And addressing it. There are some I'm going to call them well-established interventions in certain areas. So there's the strength-focused and meaning-oriented approach to resilience and transformation intervention. And this is basically a multifaceted approach to strength and resilience that incorporated Eastern spiritual teaching, physical techniques such as yoga, and psychosocial education. So kind of interventions that have been tested. The APA has a resilience toolkit. Obviously, it's focused more on psychological resilience. And it essentially includes lots of the techniques we talked about, building self-efficacy and self-esteem. A more recent intervention is the resilience program, which was tested with a group of older adults in a daycare program. And this is like a 9-week curriculum that centers around self-concepts, again, building self-efficacy, self-esteem, more at the psychological level. So just a final word on resilience. Resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it, you can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. I don't know if you can take a second now and think back on your most challenging experience and think about whether or not you had resilient reintegration or were down there rolling in your bed drinking vodka all day. And, just keep it to yourself, but take a minute and think, because it does require work. And I imagine many of you are students, and sometimes students go through very, very devastating experiences. My first course in my doctoral program, the professor, I got a C on one of the first papers because there was a lot going on in my life. I had to go to my nephew's bar mitzvah. I had to get all the kids ready to go. It's the same thing students have, right? Got a C. She calls me into her office and told me I was not doctoral material. Now, I could have fallen apart, but you know what I did? I am less than 5 feet tall, and you cannot challenge me to get over that fence. And I said, wait, lady, I'm going to show you. I did end up with an A in the course and did proceed to graduate. But it's tough being a student. You do have those challenges. Any questions? I know I'm the only thing between you and posters. Oh. I think somebody, go ahead, just scream. Oh, she's got a. My resilience is my hearing's not that good, so I just say, talk loud, not my problem.
Thank you so much for an excellent talk. I was wondering if you're aware of any studies that look at generational resilience. Are there individuals or generations that tend to be more resilient as they age based on the age where they went through global events?
That's a very good question. I would say that older, regardless, years of life are probably more important than what each generation has gone through, because you know what? We all go through something. You know, the World War II gang, uh, Vietnam, every generation. Today's world, I don't know, you know, I gave a talk once on resilience, and a 19-year-old, which I don't even know where this 19-year-old came from in one of my talks, but anyhow, it was a 19-year-old, he was a volunteer, and he asked how he could, at 19, build his resilience. And I had to really take a step back and think, well, what's challenging for this 19-year-old and how he could build his resilience? So we had an interesting talk. But I think it's more age and life experience versus a whole cohort. Look at Vietnam War vets, for example. Some fell apart and some grew.
We have a question over here.
Thanks for talking. And I just realized that for resilience is a process, but not the and just an outcome in the end. So I'm just thinking that is there any measurements for the pace of the resilience? Like if one can resilient in 3 days and 1 month resilience from 1 week. So can we say this one has a higher resilience than the other person, or we just say, oh, they got the resilience and they can reintegrate themselves in the end?
So if I'm understanding your question, can one person have more resilience than another?
Yeah, or a higher speed of the resilience.
A higher speed.
Yeah.
Yeah, and some people will, and I'm glad you asked that, because I think sometimes we all need a minute to wallow. Do you ever take a minute to wallow? Like, I'm falling apart. I deserve to fall apart for the next day. I got a 10 on a grant, right? Not looking good, right? I'm gonna wallow, and then I'm gonna pull from my toes, and I'm gonna revise that grant, and I'm gonna send it somewhere else. So some people will do that. I've also seen, and think about it even with a paper rejection. You get a paper rejection, I laugh. I say, I'll send it somewhere else. I don't care what you said. I got 400 papers, I'm not worried. Some people put that on the shelf and they never revise the paper, they never do anything, they just fall apart. So yes, people will respond different. As healthcare providers, we have to help people make sure they don't put the paper on the shelf. You gotta help your friends make sure. And believe me, I've yelled at many faculty and students who put the paper on the shelf and never did anything with it.
Okay, can I have a follow-up question for that? I want to know that can we say if one person have a higher speed for the resilience, then they will benefit more from that, or we shouldn't evaluate the difference?
So I'm not, so if one person has a
Yeah,
better response
yeah,
to
I'm just
resilience.
thinking that if if one person they can resilience faster than others, then they can benefit, like they will not have so much stressors experience from these events.
No, the stress would be the same because resilience doesn't come into play unless you're challenged. So maybe it would take something more for them to be challenged, but a challenge is a challenge. You break your hip, it's still a challenge. The person that's more likely to be resilient or has more resilience, if you want to look at it that way, they would just pop back higher. They'd probably have resilient reintegration versus the other person might not unless we really intervene. And again, that's our job, to intervene so somebody has resilient reintegration
Okay, thank you.
and doesn't turn to the vodka.
So thank you very much. I wanted to ask you to elaborate a little more on the idea and importance of growth. You didn't really talk about how one defines or measures that. One of the components that you mentioned in some of these questionnaires and in determining resilience was, quote, "I'm determined to recover." And I can understand how that relates to resilience, but it isn't as apparent to me how it relates to growth. So I wonder if you could just say more about your conception of growth and how one could assess that.
So do you mean growth in your resilience?
I think you said it was like learning from what happened and growing in the experience of that came through the challenge.
So if you wanted
That kind
to,
of growth, yeah.
right, you could look at change over time in your actual measurement of resilience. If you wanted to see if, say, I have a hip fracture, my resilience isn't great, but through that hip fracture experience, I have great providers, I learn to be resilient, I recover, I'm really proud of myself, and I grow, then the score on the resilience measure would be higher. I would consider that growth in resilience. So I think the measures can do that for you. The other way I would say people might look at it, if you had a repeat experience and you responded better the second time, that could be considered growth. And every day we wake up old, you have the same challenge. Like it hurts when you get out of bed. And how do you respond day to day? The bigger thing is there's probably a lot of fluctuation that we don't necessarily look at in resilience. If you were, like I've never seen a study that did a daily repeated measure of resilience to see how variable it might be day to day. We've looked over, longer periods of time, but, some days it's raining and you wake up and you're not feeling very resilient. But as I said, we all deserve a day to wallow every once in a while.
I think there might be some questions online. There's something in the chat. I'm not running Zoom, so I is there anyone online who would like to ask a question? If you would like, just unmute and call into the audience.
If there's no questions online, thank you, Dr. Resnick. Resilience, it's such a complex, seemingly complex measure with no actual like gold standard or whatnot. So often these measures like frailty, resilience are kind of stuck in the research world. Can you give any examples in which resilience might be used in the community or in clinical practice outside of the research realm?
Yeah, I think where it's used, and you know, we all as clinicians probably do a bit of a gestalt assessment if this person is resilient or not based on how they respond. But the measures could be used, as I said, to identify those that are really low. And it's a way to tell if your interventions improve over time. But yeah, we don't, I mean, does Joe average clinician measure frailty? No. Same thing. But you look at somebody and your brain might say, gee, they look frail. So I think it's just the difference between what we do clinically and what we do in research. The bigger key is to get people, even if it's a gestalt feeling that this person, I mean, you're not looking real resilient if you're refusing to go to therapy. So our job is to build that resilience so that they will go. And again, using some of the techniques we talked about. But what do most people do instead? Nothing. And
Okay.
let the person wallow.
Few questions online. One was wondering what work has been done with persons living with dementia. Second question is, has resilience been examined as part of a dyadic relationship, person living with dementia and the family caregiver?
So the first question was, what work has been done with resilience in people in dementia? And I did raise, I mean, some people with, you know, depending on degree of dementia, some people can respond to the measures and the questions, but usually we work with a caregiver if we want to evaluate resilience. And as I said, there's a published paper, if the person is interested, that looks at the measurement of resilience by caregivers. The interventions are the same, and I will tell you, well, I don't measure self-efficacy in people with dementia because it's a little hard to do that level of self-evaluation. The interventions that strengthen self-efficacy and will strengthen resilience work very well in people living with dementia. And then I wasn't sure about the second question.
Question was, has resilience been examined in dyadic relationships, persons living with dementia and the family, between the family member and the caregiver?
Yeah, well, we look at the caregiver evaluating the person's or giving us information, I would say, about the person's resilience. In terms of doing interventions, we have as well done some caregiver interventions. And that's really, I mean, a critical component, particularly when working with people with resilience, but people with dementia. But the interventions would be the same. They got to be the daily cheerleaders. And let me tell you, when you're a daily caregiver, it ain't easy. Cheerleading is hard.
Hi, Barbara. Thanks for a wonderful talk. There's so much food for thought here. I wanted to ask, from a life course perspective, a little bit more about changes over the life course in resilience, because a lot of what you're talking about is how to build resilience. And I'm wondering about people who have adversity and lose resilience because they don't have positive outcomes, whatever happened. They don't have positive outcomes to those experiences. They didn't find the right doctors. They didn't get the job they were trying to get. They ended up unemployed, or they have job volatility, or they flunk out of school, or they get a professor who, you know, doesn't pass them, or whatever the outcome is. Is there any way to try and assess that kind of process, that loss of resilience, and what it means for trying to develop it later in life?
Yeah, and I think that's what I said at the beginning. One of the easy, quick ways to get a sense of whether or not somebody's resilient is to ask about some of those experiences when you were challenged. And that's why I asked you all to think about it. When you've been faced with a challenge, how have you responded? And then we have to do the same thing. You know, it's no matter if you're 100 years old, you're still going to work with that person to build their resilience. So I think it doesn't, it doesn't change if they've had negative. And that's why so much of the work has been done with children and starting or trying to build resilience in children that have or are experiencing negative, whatever, social issues.
What you alluded to cultural differences. What are the cultural differences in defining resilience that you alluded to?
I wish I knew them all, and mine would just be some sort of guesses. If you travel internationally, for example, and you watch what older adults do. I'll give you an example. I lived in Israel for a year. In Israel, on kibbutz, you're old, it doesn't matter, you're still working. What is the philosophy of older adults? You see everybody carrying their groceries. In Asia, doesn't matter if you're old, you're still going to walk in the city, right? Versus maybe America, not so much focused on physical activity. So I think there's some of that. Some of it is being tough and proud in a certain culture may make people be a little more resilient. So I think there's a lot culturally we don't know, and I'm just making generalizations because I don't do international work. But I think there's a lot that we could learn from that. Again, on the flip side, it could be people are people, and no matter where you live, there's people that are resilient, people that are not. But I think there is a culture or a philosophy within a culture that would impact resilience. Good area to study, although maybe not so fundable these days.
I want to say thank you so much for the fascinating talk. It looks like, based on your talk, so much of resilience relies upon sort of your mindset by the time you experience a life-changing event, a detrimental event. Building on what somebody said earlier about the life course perspective, are there any kind of insights you have from your research around things one could be doing in midlife or earlier, interventions that could be enacted in that stage of life that could prepare you for older age?
Yeah, absolutely. And what is one of the things we saw the two little ladies playing together? Building a social network. And truthfully, everybody has little challenges. You know, the person in front of you in line at the grocery store is taking too long and you're in a rush. And how do you respond to that? And thinking about that. Any challenges, stopping and thinking and stopping yourself from going down that negative path, trying to be optimistic. And as I said, we have choices. You can be pessimistic or you can be optimistic. For some people, optimism comes naturally. But if, it's like, oh, it's never going to work, I'm never going to pass this course. Or you can say, I'm going to do it. I'm going to start. If I have to skip work, so I study. Or as I tell some of my faculty colleagues, don't go to that meeting. If you've got a grant to put in, just don't go to the meeting. No one's going to die, right? So thinking about how you respond can help you build resilience for the bigger challenge later. As I told the 19-year-old, if the girl didn't want to go out on a date with him, how would he respond? I did not know how to answer. But thank you all very much, and good luck on the posters.